Welcome to another Easy Nursing Review. In this lesson, we will cover metabolic syndrome. Now, let's begin by first learning, what is metabolic syndrome? Patients with metabolic syndrome have a collection of symptoms that include high blood glucose, obesity, high blood pressure, and high triglycerides based on family history. Beta cells in the pancreas are unable to produce sufficient insulin while the liver produces a higher level of glucose. The patient is also insulin resistant. This syndrome leads to cardiovascular disease. Now here are the signs and symptoms of the patient. The patient will present with hypertension plus abdominal obesity. Now let's go over important labs as they will reflect the following: decreased HDL, increased LDL, increased triglycerides, elevated fasting glucose. Okay, let's move on and learn about treatments for metabolic syndrome. Medications will be niacin. This is administered to raise HDL. Fibrates. This is administered to lower triglycerides. ACE inhibitors. This is administered to lower blood pressure. Angiotensin receptor blockers, which will lower blood pressure. And lastly, insulin sensitizers to improve the effectiveness of insulin. Great. Now let's move on to nursing actions. Monitor blood glucose. Encourage weight loss. And with nursing action comes patient education. Explain to patient the importance to continue medication even if symptoms are not present. Well, that ends this lesson. Click here for another nursing video.